Dr. Charles Raison. I'm on the steering committee for Psychiatric Congress. I'm here today with Dr. Michael First, expert on the DSM-5. So I have an uncle who passed away, and we went clear out his house. Literally, there were canyons through the house of stuff. And he tended towards OCD. And, you know, I always envision hoarding as a subset of OCD, but this doesn't really, the data don't really support it. It's been changed, hasn't it, in DSM-5?
Yes. I think one of the more significant changes in DSM-5 was the introduction of hoarding disorder as a separate category. Okay. Now, hoarding has always been an unusual, I mean, we've always known it exists. Yeah. In the situation with your uncle is
incontrovertible. You see the house, you know it exists.
Reality shows about hoarders. It's a fascinating condition. And DSM has never quite adequately handled it. So one of the things they did is one of the items in obsessive compulsive personality disorder is difficulty throwing out objects even though they're worthless. So that is hoarding.
Yeah.
But most people with hoarding disorder do not have OCPD, so you can't use that. So what I think most clinicians did, without really knowing any better choice, is to call it OCD.
Yeah.
But it turns out that hoarding and OCD are really separate conditions. The treatments for OCD, which are very effective, somewhat effective, don't work for hoarding at all. The people with hoarding don't actually have obsessions and compulsions. So an obsession is this repetitive, distressing thought, and a compulsion is this behavior you do to reduce your anxiety. The people with hoarding, their problem is the inability to throw things out. So they don't have any, I mean, if somebody were to come with a bulldozer and clean their house out, they'd have a lot of anxiety, but that's not the kind of anxiety you see in OCD.
They're not doing something to control their anxiety as opposed to doing something to control their anxiety.
So it seems to be in the ballpark of OCD, but it's not. So in fact, what DSM-5 did is two things. That hoarding disorder is now added as a category, and there's a new grouping in DSM-5. It didn't exist in DSM-4 called obsessive compulsive and related disorders. So reflecting the relationship between hoarding and OCD. It's not the same condition, but there's clearly seem to be some underlying connections. So hoarding is in that grouping within the DSM-5, but it's a separate condition.
And that grouping has been removed from the spectrum of anxiety conditions.
Right, so OCD was pulled out of the anxiety disorders, and then
body dysmorphic disorder, I assume, and
body dysmorphic disorder there, hoarding's there, trichotillomania, and excoriation disorder, which is this new condition of skin picking.
Yeah.
And they all share in common this sort of repetitive, compulsive behaviors all grouped together, but they are separate conditions.
Yeah. And for hoarding, do we know much about the treatment other than coming in with the bulldozer? When we mentioned that OCD stuff doesn't work, what do we know about actually?
I believe the hoarding remains a challenge, and one of the good things about putting something in the DSM is it puts the focus on it, and the hope is that there'll be a lot more research.
Figure out some sort of way to help people.
I think that probably the most effective treatments, and it's still only somewhat effective, is cognitive behavioral therapy. Well, the problem is a lot of these people, much more worse than OCD, is they don't go out and seek treatment. Because the one thing about OCD is it's ego dystonic, the obsession.
They're miserable.
They're miserable, exactly.
Yeah.
They know they're wasting their lives doing these obsessions. People with hoarding rarely see there's a problem. They'll have their entire house filled up, and they'll keep arguing that there's no problem.
No problem. Yeah, exactly.
So I think that so even the therapy, the cognitive behavioral type therapy, would be probably the treatment of choice to get them to actually participate in a therapy like that when they don't see anything's wrong. The beauty of medication is you don't have to be that convinced you have a disorder to take a pill.
To get a benefit.
But you really have to be accepting that you need to have change if you're going to do psychotherapy, and people don't do that.
Yeah, fascinating. Thank you so much.